These are the supplies required for accessing a hemo line for IV intermittent infusion. 1 blue pad, 1 package of 4x4 gauze, chlorhexidine gluconate swab, 2% without alcohol preferred, clean gloves, a Luralock injection cap, a 10 cc normal saline syringe, and then for locking either sodium citrate or heparin, 10,000 units per mil, with normal saline vial and a 3 cc syringe. Please keep in mind that this is a sterile, no-touch technique and proper hand washing is required. Start by having your patient in a comfortable position and have them as flat as possible in a bed or chair. Place a blue pad under the catheter. Then remove all gauze and tapes from the catheter. Perform proper hand hygiene and put on some new pair of gloves. Have your patient turn his or her head away from the procedure and minimize talking. Keep in mind that the patient does not need to be masked unless they're coughing. Ensure that all the clamps are closed. Start by lifting your catheter and placing it on top of gauze. Open your package so that it provides a sterile field. Remove the cap from one port and cleanse it using a chlorhexidine swab. Be sure to tear off the end of your swab and open your packet so that you can create a pouch as so. Rub vigorously to remove old blood and allow to air dry. Be sure to use a no-touch technique. Open ports and ends of lines must not be touched with hands. Repeat this procedure for the second port if needed. Next, attach a 10 cc syringe to the port. Unclamp and aspirate 2 to 3 cc's to remove citrate or heparin and to check patency of each port. Be sure to reclamp. Ensure your line is clamped, then remove the syringe. Attach the Luralock end of the IV tubing to the open end of the catheter. Be sure that the connection is tight. Open the clamp on the catheter and on the IV tubing and ensure that the fluid is infusing as required. Loop the tubing on the chest wall or leg of femoral line and tape securely. Ensure that the cap and label are secure on the unused arm of the catheter. Once the infusion is complete, proceed to locking your line. Remove the tape and prepare your supplies. Prepare your sterile field using a 4x4 gauze. Ensure the line is clamped. Remove the old IV tubing Cleanse the catheter hub with chlorhexidine if it is visibly soiled. Attach a saline syringe to the catheter hub. Open the clamp on the catheter and inject at least 5 cc of normal saline to clear the catheter. Then reclamp. Next, examine your hemo line to determine the volume written on the line. Note that different hemo lines have different volumes. Attach the citrate syringe directly to catheter hub. Open the clamp and inject citrate equal to the volume written on the line, and then close the clamp at the end, creating a positive pressure, and remove syringe. Use 10,000 units per mil. Draw up 5,000 units, or 0.5 cc's, mixed with enough saline to fill the volume indicated on the catheter arm. Inject the heparin equal to the volume on the line, and then close the clamp at the end, creating positive pressure, and remove syringe. Have your Lirolock injection cap ready and attach it to the catheter hub. Ensure the clamp is facing upward before reclamping for patient comfort. As well, try to reposition the clamp with each access to extend the life of the catheter.